Welcome back. Health experts are raising the alarm. Hypertension, of course, is no longer just a middle-aged issue in Nigeria. Now, based on recent reports, it shows a surge amongst young Nigerians with lifestyle, diet, and lack of awareness as major drivers.
And so today's guest is Olawale Ogunlana. He has been doing extensive work in health awareness and youth outreach. And he joins us now on the program to discuss the concerns as well as the data. Olawale, thank you so much for joining us this morning.
Thank you. Thank you for having me.
Thank you for being here. Let's get started, shall we? Because we're pressed for time. What do the latest figure tell us about hypertension in Nigerian youth, and how dramatic is this rise that we're looking at?
Okay, so I'm just going to give a background story a little bit.
Okay.
I think it was 2 years ago. There was I had a 35-year-old man who came in and he had symptoms of stroke. And it was quite shocking, to some of my team members at that point, because they felt that at 35, why are we having somebody who has a stroke case? And, this is the trend that we are beginning to see. A lot more Nigerians are coming down with elevated blood pressure. And part of the reason why this is happening is because a lot of people believe that they are young, so they are not exposed, they are not supposed to be at risk. And the fact that it is supposed to be, in quote, an old man's disease. But then another thing that we forget is that our lifestyle has changed. Our diet has changed. Environmental factors has changed. And people are living in highly stressful environments right now that have put them at risk of high blood pressure. And also, we have to remember that there is a genetic predisposition for people, especially people of color, to hypertension. So when these things happen, when you when you are exposed to environmental triggers, you are exposed to lifestyle and diet triggers, it easily activates this genetic predisposition that puts you at risk of high blood pressure. So yeah, we are having a situation where a lot more people now are coming down with elevated blood pressure, and some of them even up to the level of stroke, because nobody is paying attention to it. And like we always used to say, hypertension is a silent killer, and that is the reason why it is affecting so many people at this time.
Dr. Ogunlana, please give us some details as to key lifestyle factors contributing to this trend, especially amongst younger Nigerians. I'm asking what habits should be changing and what should remain.
Okay, so when it comes to lifestyle, first of all, let's even talk about it. We are not sleeping enough. I think I'm going to start there. And it might look like a joke, but I blame a lot of motivational speakers for this, because a lot of people say that, oh, don't get enough sleep, don't sleep. You need to. Why men slept? You need to toil. Please, you need to sleep. Your body demands that you get at least 8 hours of good sleep. But then it turns out that a lot of Nigerians now, because of course, the state of the economy, the fact that you need to work multiple jobs, the fact that you need to do so much for yourself and then for your family. So you end up not having quality time for you to sleep. And this in itself is a risk factor that is putting people at risk of hypertension at a very young age. Then there is increased screen time, because a lot of people, of course, what people don't know is that you're spending a lot of time on your screen, and any screen is capable of emitting blue rays, right? So there is this, there's blue light that is emitted from screens, and that blue light actually tricks your brain to stay awake, right? So these are some of the issues that we are current, these are some of the lifestyle changes. A lot of people are working remotely. A lot of people are using their mobile phones, their laptops to work, There is this sedentary lifestyle too. When I was young, I remember, we used to do something called PE, or, physical education, where we would go out and, exercise. You know that this is time for PHE, you need to go outside. But we are rarely seeing that these days. In fact, a lot of people are saying, no, don't allow my child to go for PHE, or my child doesn't need to do PHE because they will break their body, they will have fracture and all of that. Because of that, a lot of people are adopting more sedentary lifestyles. Even at work now, everybody is sitting in front of a laptop, everybody is sitting in front of a screen, and they are not, there is no activity again. So there is a reduction in activity. For instance, too, when it comes to transport, you are sitting down on driving to work, you are sitting down in the bus heading to work, you are not standing. A lot of people are spending less time standing and engaging in proper activities that will improve their heart health. So these are some of the issues. Then there is the diet one, and I think I will spend a bit more, just a little bit of it. What has happened is we have successfully westernized our diet. What that means is that a lot of people are eating more shawarmas, pizzas, chicken nuggets, things like that. Things that we normally 10, 20 years ago, we were not eating this. We are eating it now. And people have called it like their diet, noodles, right? In fact, if there is any food I have serious beef with, it is noodles. All of these kind of lifestyles are actually affecting us in one way or the other, putting us at risk of elevated blood pressure. And it's not as if each of them is a direct cause, but then it's a risk factor. It is increasing your likeliness of you coming down with high blood pressure at a very young age.
Now, you're talking about, you're an advocate for awareness campaigns and routine screening. So I do have to ask about the visibility, to normalize blood pressure checks the way that we do malaria or even HIV tests. Is it possible to get more younger Nigerians to, get their blood pressure checked routinely?
Okay. One of the things one of the reasons why I feel the work that I do is very important is because we are trying as much as possible to attach or to create a value mindset when it comes to health in Nigeria. Nigerians need to understand that health takes precedence before anything else. And that is the most important thing that can change the mindset of any Nigerian. So what do I mean by that? What I mean is, as you care for your food, the kind of food that you eat, you should also care for the state of your health. If you would have a car and you will not drive it for 2 years without taking it to the mechanic shop for servicing for at least 2-3 times within that 2 years, then you have no excuse for not going to see a doctor at least once a year to evaluate and to check and see if everything is going well. Now, when we narrow it down to hypertension, we need to create a lifestyle that enables us to know that it should be a religion. It should be our religion that when you wake up in the morning, you should check your blood pressure. After you've done your prayers and your meditation, the next thing you should do is to take your blood pressure machine and check your blood pressure. Why I'm saying this is because, like I said, people of color and people, black people, like, African people who are, of African origin are much more likely to develop hypertension for reasons that are yet to be discovered. So it is very, very important for us to adopt a new lifestyle and a new approach when it comes to blood pressure. It has to be a lifestyle. Right now, what I'm saying, I'm going to give an example. A couple of years ago, I remember when I was a young child, drivers didn't see it necessary to wear seat belts when they were in traffic or when they were heading into the road, until the federal government came up with an initiative that if we catch you without you wearing a seatbelt, we are going to fine you. And before you know it, people started wearing seatbelt not because it was safe, but because they were going to be punished. But eventually, people started adopting a mindset that right now, nobody enters the front, the driver's seat or the front passenger seat without considering first to wear a seat belt. Now, I'm not saying that kind of approach is the kind of approach that we need towards health, but I'm saying that we need to adopt and embrace a mindset, a value mindset towards health. For instance, when it comes to checking your blood pressure, we need to come to that position where when you wake up in the morning, the first things that you do after you've said your prayer, greeted your family, is to check your blood pressure, is to understand that you need to have a sphygmomanometer at home, is for you to understand that once in a year your family needs to take a trip to the hospital, and the hospital shouldn't be a place where you are going because you're sick, but because you're going there to check your status and to prevent sickness.
Now, when we look at urban youth settings, now I'm talking universities, tech hubs, informal sector, what obstacles would you say exist for, prevention or early diagnosis of hypertension?
Okay, so when it comes to that, I want to say that I think what is the greatest challenge is that these hubs, they are good, first of all, but I think they are much more centered on the productivity and the work, and not on the wellness. The wellness of the individual is not prioritized enough, right? I am a proponent of ensuring that these spaces, these hubs, are prioritized not just for productivity but for wellness as well. They have to ensure that these centers, for instance, you should have a sphygmomanometer, a digital sphygmomanometer in these tech hubs that anyone can work and can walk in and check to ensure that they have their blood pressure checked after they've been standing for a while. There should be measures to ensure that when you've sat down for about 30 minutes, you should be encouraged to take 30 minutes, or if you sat down for 1 hour of work, you should be encouraged to stand up from the system, take a break for 30 minutes, and then engage in some cardiac activities. These are some of the initiatives that we need to adopt. We need to ensure that these hubs are not just hubs for productivity and startup life and startup culture, that encourages sedentary lifestyle. People will be sitting down for 8 hours, coding, creating, animating, writing, doing all of this work on the screen, but they are not taking breaks. These things have to be prioritized, and these workspaces have to be injected with a bit of wellness towards the individuals, in recognition of the the culture and the new way of work that has become a trend in young people.
Finally, as we wrap up this segment, I do have to ask, what would be your top 3 interventions, when we look at a way to sort of launch a national youth-centric hypertension program, whether it's an awareness campaign, what would be your top 3 interventions? What would you like anyone who's organizing, or if you are them affairs, to sort of focus on? Very quickly.
All right, that's a very good question. I would say that at the moment, I'm currently working with with CCSI there is a widespread campaign to ensure citizen education as regarding diet, which is the regulation of salt and sodium in our diet, to ensure that people can adopt a lifestyle. So to directly answer that question, first of all, we need to meet young people where they are, and that is why interventions through public health literacy on digital platforms is of utmost importance right now to Africans and to Nigerians in general. Another thing is we need to have some level of reward system for people who prioritize health and wellness. What I mean by that is, there should be some maybe kickbacks in, for instance, you get insurance points if you check, you ensure that you go every year or twice a year for health checkups. You should be able to get some loyalty points that will allow you get access to some certain medical interventions that you would have otherwise paid for. Another thing is to ensure that there should be wellness has to be injected into our workspaces. So for instance, even in public institutions, even in public workspaces, there should be digital sphygmomanometers, community health extension workers who are there to provide the basic health education that will that's not just the basic health education, but then the basic health screenings that will keep Nigerians and the citizens on their toes. So even in private healthcare, even in private settings and in private workspaces, I will also advocate that there are how should I say, wellness services that are also injected into these things. Public, when it comes to lecturing and teaching and educating your employees, that should be done. When it comes to health, when it comes to checking and screening on a routine basis at least once a year, that also has to be done. Ensuring that citizens also have access to social health insurance as a basic health right. That is also something that I will advocate. Thank you.
Absolutely. Thank you so much. And also, just to put it out there, there are a number of pharmacies that you can go to get your blood pressure checked for free and also get your weight checks for free as well. So just a PSA out there for individuals. Chiwete.
Thank you, Dr. Olawale,
Yeah.
for shedding light on this hidden but growing health threat.